Good morning. How are you today? Let me know how you're doing today. I appreciate you. Um, Always want to know how you're doing. Make sure that everybody's healthy and well. If there's things that we could do to help you, we want to do that. It has been a morning at my office this morning. You know, we have about 18 staff here, a couple nurse practitioners, our whole crew that is here to help you. And one of my case managers was somebody walked right out in front of her car this morning. And fortunately, both my staff member and the person that walked out in front of her car are going to be okay. Everybody's a little bit shook up, but it has been created a little bit of a whirlwind of a morning around here. Any of you have those mornings where things don't go as you expected, and they sure throw a wrench in all the works, and you're like, oh no, what am I going to do to get everything done? Well, now I'm short a staff member, but we are very, very, very thankful that everybody's okay. So I want to, by the way, what I just went over with you is not the way to lower your blood pressure, but tell me, do you want to know how to lower your blood pressure? Some simple thing you can do to lower your blood pressure. Is that something you'd be interested, or have a loved one know how to lower their blood pressure? Is that something that would be important to you? You guys can comment and let me know. So lower your blood pressure by 20 points. How about 20 points? Systolic and diastolic. That would be crazy, right? And lower your blood pressure. So how do you do that? All right. So I'm going to go over this with you. I want to lower your blood pressure by 20 points. Try this exercise. It's an exercise. Guess what? It's super, super easy. You don't have to join a gym to do it. It's not a strength exercise. You don't have to, again, you don't have to join a gym. You don't have to be crazy strong to do it. It's super easy. It's isometric exercise, okay? So things you could do at your desk, right? So I'm going to show you this. Isometric exercise, contracting large muscles without actually moving the body part, is an isometric exercise. It can help you reduce blood pressure pretty easily. Now, the way this was discovered, pardon me, this is not some crazy huge study, but it was pretty amazing, right? So NASA and the Air Force, they were finding that the Air Force, actually, Dr. Ronald Wiley, he was an expert in heart and lung physiology, and he wanted to find a way to keep fighter pilots from losing consciousness when they were flying like an F-16, right? So they have these high G turns and everything, and it takes the blood all out of their head, and then they lose consciousness while they're flying this multi-million-dollar plane. Not a good thing. So this doctor was trying to figure out how to keep blood pressure higher in these people. And so what he did was he figured out that having, they said, you know, when you squeeze really hard, his theory was, wow, if you squeeze something really hard, your blood pressure is going to go up, right? So I just make sure I get this right. He said that would effectively keep blood from flowing out of the brain and keep somebody from losing consciousness. So they actually installed in an F-16, reportedly, they installed this bar where they could just grab a hold of it and squeeze. And then they also had these fighter pilots doing this exercise when they were not in the airplane. So they're just squeezing really hard, just squeezing their hands, just holding a contraction, right? So, but what happened was it wasn't actually helping. He found out that by squeezing and maintaining that squeeze, just a squeeze like an exercise ball, a tennis ball, or something hard, they were squeezing it, an isometric contraction, it actually found that it lowered their resting blood pressure. It was actually the wrong effect that he was looking for, right? Otilia, thank you much. Husband has high blood pressure. Doctors want to put him on medication. So he should try this first, right? So you want to do isometric exercises. So what are the exercises you could do? Sitting at my desk right now, I have the desk right in front of me. I could put my hands palms up underneath the desk and just pull up on the desk and squeeze with my biceps, like I'm like I'm trying to lift the desk, but I'm sitting down and obviously the desk is not moving. So I'm going to hold that for 10 seconds, 30 seconds, and you're going to do that 2 or 3 times. And you're going to give a good squeeze, but you're not trying to lift the desk off the floor. You're just trying to get a good squeeze, right? You get an athletic gripper, one of those things you squeeze, right? One of those things you squeeze like this. Hold it in one hand, or a ball in one hand, squeeze it for 60 to 90 seconds, okay? And you're going to do that like 2 or 3 times. So do it 2 or 3 times a day. Right? So just grab one of those things and hold it. Not back and forth. We're not trying to squeeze back and forth. We're trying to hold a contraction. Squeeze and hold. You could take a like a soccer ball or something, or even just a tennis ball, and put it between your knees. Tennis ball's a little small, might hurt your knees to do that, but take a ball, put it between your knees while you're sitting at the desk, and squeeze and hold that ball in between your knees. So that's one way to do an isometric contraction. So they said in doing this, they did this 15 to 20 minute sessions every week for 10 weeks, on average, a 10-point difference in their blood pressure on average, and that was systolic and diastolic. So that was a static hand grip, a leg squeeze, flexing your glute muscles, like squeezing your butt muscles, sitting there in the chair, squeezing your butt muscles. You want to probably do it as hard as you can, right? Let's face it, when you're sitting in a chair, you're not using those muscles anyway. They get weak, so you want to use those. Some other ones some other benefits that there's also doing like a plank, right? Now this is that's more of an athletic move, but a plank is an isometric contraction. What they found in doing a plank, make sure I'm giving this to you, was doing that for 10 seconds, just a plank for 10 seconds, 2 or 3 times. So we're talking about 30 seconds total, right? So it might take you a minute to do it. Was one of the simplest forms of an isometric exercise, and it really works your core as well, but only for 30 seconds. This is doing this every day, just a couple times for 30 seconds. Doing an isometric push-up, that means getting down into a push-up position and being halfway up, halfway down, and holding it in that position for 10 seconds. Count slowly to a count of 10, right? A little bit more difficult, but is a shoulder raise, grabbing a small dumbbell in each hand, small, 1 or 2 pounds, holding it up, an isometric contraction with your arms at about 90 degrees. That one was for 10 to 15 seconds for 2 to 3 times. So what else does a simple isometric contraction do? It's going to help strengthen and condition your muscles. It's going to aid in strengthening your dormant muscles and isolated muscles. Let's face it, we're pretty weak as a society now. We're not using our bodies. We're sitting at a desk now. 80% of our population 100 years ago had a physical job. Now 80% of our population has a sedentary job. It improves your control of your body, improves your body and posture and your spine alignment. Super important. We're going to talk about more of that another day. Helps prevent injury, exercise use and injury rehabilitation. Helps in development of lean muscle, improve bone density, makes your bones stronger, increases resistance and power and endurance. They activate, generally some of these, like a little plank for just a short period of time, activates all the major muscles in your body. They can be done pretty much anywhere at any time. I'd advise not doing a plank in the bathroom floor at your office building. They don't require any equipment, sometimes just a dumbbell, right? So these are things that you can do. We want to lower your blood pressure. Now, the interesting thing about blood pressure, I saw somebody about putting their husband on blood pressure medication. The one thing you have to consider is your brain controls the size of your arteries. Your arteries have a muscular wall. And the muscular wall, so the blood's flowing through here, and your arteries, your brain can control that muscle wall to expand and contract the size of that vessel, increasing and decreasing your blood pressure through what your brain tells your arteries to do. So one of the things that's important to remember about high blood pressure is pretty often actually is high blood pressure is your brain trying to make sure that you're getting blood to areas that with low blood pressure you normally would not. So if your brain is trying to raise your blood pressure and you're taking a medication to lower it, the medication is actually circumventing what your brain is trying to do to fix a problem. So high blood pressure is not always a problem. It's actually a solution to a problem that your brain is presented with. So your brain is trying to run your body all day long, and let's say your blood flow to your toes isn't that great. And hi Lisa, hi Jenny. So you don't have good circulation to your toes. Well, your brain can actually raise your blood pressure to make that happen. Well, you have this happen if you're like my staff member, almost in a car accident today, right? You almost get in a car accident, you feel your heart beating rather rapidly, your blood pressure goes up. That's that fight or flight response. While in the case of sitting here at my desk and dealing with a schedule that's now all wonky, I don't want the fight or flight response to happen to that level. But if you were in a stressful situation, you want your blood pressure to go up. So one of the ways that you reduce stress is going out and taking a walk, getting a look at the outside. I have a window that looks outside. So it's my first office with a view. There's a river right behind us. It's actually a pretty nice view. So you want to lower your stress level, but doing these exercises, remember isometric exercises don't take a long time. You're talking about a few minutes a day. Isometric contractions lowers your blood pressure according to this one study, 10 to 20 points. So try this. Really appreciate you guys watching. And by all means, as always, I know I say this over and over again, but please share. I love it when you hit that share button. It helps us get this information out to other people. If we can be any of assistance to you, send us a direct message or you can comment. Let's face it, this is social media, so we're not bound by HIPAA here. But I can also give you, it's impossible and probably unethical for me to give you direct medical advice over the internet. But I'm happy to give you any basic advice that I can and help you improve your quest for health. Thanks for watching. I'll come back to you later today, provided my schedule is not super crazy, and we'll give you some more information. Thanks for watching. Have a wonderful, if you're watching this later, right now it's Tuesday. If you're watching this at some other time, it's Tuesday, December the 11th, right in between Christmas, right between Thanksgiving and Christmas. Looking forward to this holiday. You guys have a great day. Bye now.